Regarding oxygenation, maintain an SpO2 level of greater than 90%. A nasal cannula with surgical mask placed over the cannula is the preferred method of oxygenation. Providers may use higher than normal flow rates, up to 7 liters per minute if needed to maintain the desired oxygen saturation. If the patient is persistently hypoxic despite use of a nasal cannula, apply a non-rebreather mask or NRB. Restrict nebulizer treatments to patients who are exhibiting signs of moderate to severe bronchospasm or wheezing. Nebulizer therapy is associated with a significantly increased risk of coronavirus aerosol transmission and EMS provider exposure. A metered dose inhaler, or MDI, with a spacer, if it's available, is the preferred route of medication administration. Consider 4 to 6 puffs per dose of an MDI with a spacer if available. This may be repeated every 5 minutes as needed. Use of the patient's MDI with the spacer, if it's available, is preferred. CPAP and BiPAP should be used with caution in suspected COVID-19 patients. CPAP and BiPAP is associated with a significantly increased risk of coronavirus aerosol transmission and EMS provider exposure. CPAP and BiPAP should still be considered in the patient who has other, more obvious reasons for their respiratory failure. For example, in the setting of recent weight gain, edema, and a history of cardiac disease. If EMS providers feel that it is essential, consider contacting medical control. Corticosteroids have shown no clinical benefit and may actually be harmful in patients with COVID-19. They should therefore be avoided in the non-critically ill patient. For AEMTs and paramedics, consider administering epinephrine 1 mg per milliliter at 0.3 milligrams IM in the lateral thigh, which is preferred. Endotracheal intubation should be avoided in suspected COVID-19 patients. Intubation is associated with a significantly increased risk of coronavirus aerosol transmission and EMS provider exposure. This is an incredibly high-risk procedure in terms of transmission and is best performed in a negative pressure room with the highest provider level and most experienced provider. If EMS providers feel that it is essential, consider contacting medical control.